And they see.
100 grams. 100 grams. I mean, basically, when I say see what is happening to people, like, I think we should all be doing this stuff. If I was just sitting there listening to people with the way to say it. I would have fallen asleep. I would have fallen. There's so much glare on it.
I know. I just keep trying to get her backpacks out of the screen.
I wonder if we can turn it off. Like,
Probably, yeah. Yeah.
giving me the witness statements. Giving me the witness statements is a good idea. I knew to Hello? Can you hear us? I can multitask, so like I was reading my listening to what you're doing.
My partner says she cannot hear our mics. Okay, testing. Testing mics.
I'm sorry. So many bags. Hi.
It's spooky in here.
Oh, okay.
I do appreciate that. Yeah. I'm a naturally
Oh, I know. I don't have my Bluetooth. Oh, wait. Yep. Oh, it's so quiet. Oh my God. Okay. We are live streaming on YouTube, and our microphones don't work. None of you can see. If you're worried about your confidentiality, anonymity, but I don't think our microphones are working. So whatever. First of all, happy Halloween, Andy. Yay. Okay, so the New York Times came out with an article yesterday saying, please don't stress about Halloween candy, just eat it and enjoy your life. So the New York Times said that, so eat the candy, okay? Unless you're having an allergy, then please don't, because we're both have PhDs, but we're not medical doctors.
I do have an EpiPen, but I'd rather not use it on kids.
Sure, right. They're very expensive. Okay, so we'll get started. Okay.
So welcome everybody. This presentation is on implications of internalized sexism for women identified counselors. We are both from Western Kentucky University. Yeah, what happened there? This is called Allison Business Play. Stuff very much. I have that chat. Come here.
Okay.
I don't know how it switched. What did I do? That is so bizarre. We decided to make things really interesting.
And then it's like based on which one is set up.
I think if you hit switch display,
Okay.
put the projector view on the computer.
Oh, thank you. Presenter view, right there.
Oh, thank you.
Okay. We didn't want you to see our slides and know our tricks before we did, okay? Okay. So we're actually going to cover a lot in an hour, so I hope that you all strap in with your candy, because it's going to be a wild ride. So Allison's going to start us off with the first couple of spots. We're going to overview sexism, because we can't talk about internalized sexism without talking about sexism. However, they are different. Then defining what internalized sexism is, the psychological and clinical impacts, how we connect it to the counseling profession. And then I'll talk about the research study that I just finished about 2 minutes ago. Finished in the sense of the data collection, not the write-up. And then what we can do. And if we have time, reflections, and if not, that's also okay. Oh, God. All right, so I'm Dr. Sarah Pickett. I'm a professor at Western Kentucky University. Allison is my student, which I feel very excited about to always bring students to co-present. I think it's very important. This is my 4th year's full-time tenure track professor. I also do private practice clinical work. I've been working in mental health field for 11 years. and I supervise master's students. I wrote my dissertation on incarceration, mental health, and couples. And I have shifted a little bit to focusing on more of a feminist framework for editing this book about women, intersectionality, and trauma-informed care. Working with the publisher right now on what that will look like. And mostly I'm concerned about the cover art. I just want the cover art to be really cool. That's just my aim. And
Good luck.
yeah, I know, it's going to be so dorky. And then this research project that we are talking about, that is this presentation, has taken up a lot of my time, and it has felt very meaningful and exciting. So I've worked extensively with kids. I mean, really the range is pretty big. LGBTQI+, clients who have suicidal ideation and complex PTSD and acute anxiety.
So I am Allison
Hmm?
You just described it.
Are we twins?
Langdon.
Wonderful. Nice to meet you.
I
You said
am,
yourself, right?
Yeah.
I'm Dr. Allison Langdon. My PhD is not in counseling, it's in medieval literature. In my other life, I am a professor of English at Western Kentucky University, but I am also a second-year master's student in the counseling program. My academic work has focused to some degree on gender representation in medieval literature. And as a second-term department chair, I have had some interesting experiences both with mentorship that I have received as a woman in leadership and mentoring that I've given to other women. I'm also really interested in things like burnout and imposter syndrome.
So very, very quickly, who are you and what brought you to this session today? I think because we're a little bit behind, I'm not going to go through every person, but I would love for a couple of folks to just share out who are you and why did you decide to come to this session specifically today? Yes, my twin.
I'm a 50-year-old woman who's dealt with shame her entire life, and I
Okay.
need to understand it a little better before I'm in the room helping someone else to understand.
Great. Okay.
I'm a first year grad student at OSU. I am originally from Ukraine, so a very conservative, different environment, so I'm trying to educate myself more in that to not bring my old beliefs into my counseling.
Yeah.
I am a lesbian clinician who works primarily with post-secure folks who identify as women or non-binary, gender expansive, and women. So anything with that title is sold.
Anything with the title of woman, you're like,
Yeah.
I am there.
Yeah.
Wonderful. Okay, great. Thank you for sharing. And thank you all for coming. Yeah. In our cozy little makeshift room today.
Our little cave.
Yeah, right.
Here, yeah. So we're going to start out just defining terms. When we talk about sexism, what we're really talking about here is the belief, behavior, and institutional practices that harm individuals by discriminating according to gender or contributing to the perpetuation of gender inequality in society. So it's kind of just a broad definition for us. We really are looking at three different levels of sexism. At the broadest macro level, the institutional level, this is where we see laws that might discriminate unfairly against women. One of my favorite ones, which is still from the 70s, but since I know women who were impacted by this, was that women couldn't have a credit card in their own name. This also impacts government policies, workforce, things like maternal and paternal leave policies, that sort of things. At the interpersonal or meso level, we're talking about sexism in social relationships, power imbalances and inequality in those kinds of situations. And then our primary focus today is internalized, so that's the micro level. This is sexism that women point at themselves or at other women, limiting access to power and resources. What's tricky about sexism is that it often is invisible. We're so used to seeing it that we don't see it at all. There's a lot of different ways that it can be disguised, so it might not be super overt, but we have gender socialization woven through every aspect of our culture and our society. Gender socialization is the process through which individuals learn the behaviors, expectations, and roles that are associated with their assigned gender roles. And this can start, of course, at birth.
Before birth.
Before birth, indeed, as soon as we get that amnio, right?
Mhm.
Yeah. So classic example is parents dressing their baby girls in pink and their baby boys in blue, buying the girl dolls, buying the boy trucks, etc. Although if you study history, you'll find out that pink used to be a masculine color before the 1900s, yes. Gender socialization creates very rigid expectations about how women are supposed to behave, how they dress, how they interact with others. Judgment, values on their behaviors and choices, which can pave the way for sexism to just comfortably exist in society. Some forms that we want to touch on. The most obvious is going to be hostile sexism. So this is much, much more overt. This is when we see active denigration of women, definitely prioritizing males and masculinity over females and femininity, definitely directed towards women who exhibit non-traditional gender roles. Mostly this is going to communicate views of gender relationships as competitive. So one of the things that's really fascinating when you look at some of the more masculinist fora, for example, online, the general assumption is that what women want is to take power away from men, right? Not to share power with men, but to take it away. They cannot imagine a scenario in which the tables would just be turned so that men can become the oppressed. Benevolent sexism, benevolent meaning kindness, right? Seems positive. Seems like it is caring for women, it is protecting women, but it is still its own form of prejudice. It is generally predicated on the assumption or the requirement that women still engage in stereotypical, traditional, and restrictive gender roles. So if you are behaving like a lady, like a woman, then you are protected. If you move outside of that, then you lose that protection. This tends to portray gender relationships as complementary and positive, but is still reliant on the binary. Men are in charge of protection and security. Women are dedicated to nurturing and reproduction. When we look at these together, it's referred to as ambivalent sexism. When we think of the word ambivalent, sometimes it means like we can't make up our minds. I like to kind of maybe point out the Latin roots of the word ambivalent, which is both ways, right? Which basically means you're screwed either way. We'll talk about that later.
Don't worry.
There are many impacts of sexism, of course. Ambivalent sexism creates a kind of paternalistic or patriarchal lens towards women and sexual minority individuals. So anybody who's going to be violating the boundaries of those gender norms. So gender roles definitely play a major part in this. There's a lot of distaste towards non-traditional gender roles. So a female breadwinner, for example. And there's positive reinforcement of traditional roles. Self-esteem can be deeply impacted by this as well. We all, I think, are familiar with the ways that women's self-esteem can be negatively affected by stereotypical beauty ideals. These are largely projected onto women and can really lead to a lot of body dissatisfaction, even if you're aware that it's happening. That's really what we're getting at when we're internally. It tends to produce feelings of threat, so there's increased stress response, anger, and anxiety. Negative beliefs associated with sexual assault, so assuming that the victim was in some way inviting the assault or put themselves in a situation where they were asking to be assaulted. And there are a lot of physical consequences that are associated with that kind of constant stress threat. If you think of all of those means with women walking to their cars, carrying their key, ready, right? That level of threat does take a toll on the body, especially the heart. At work, There are often fewer opportunities or recommendations for women. One of the things that is really interesting is looking at the kinds of letters of recommendation that are written for women applicants to jobs versus male applicants to jobs, and the kinds of adjectives that they use. So men will have agentic words, which means they are doing the thing, right? And they are standouts. They're the top one who's doing the thing. Women tend to have more communal verbs or adjectives. They might be dedicated and hardworking, but not brilliant. So they'll put in the work, but they're not necessarily way up here. And that shows up in letters from men and women. There are stereotypical career options that are generally offered to each of the genders. For women, this can lead to reduced self-efficacy and dependency-oriented support for women, especially because a lot of those jobs that are female-coded tend to be lower paying, so there's greater financial needs involved as well. So for internalized sexism, this is when there is a kind of passive acceptance of traditional gender roles and unawareness or even denial of sexism existing. Gender stereotypes, role expectations, objectification, these kinds of things are constantly reiterated and they're reinforced by all genders. So again, this is not just something that men do to women, it is something that women do to themselves and to each other also. It's not a deficit in women, it's not that we are flawed, and that's why we keep doing this, but it is a source of distress that is coming directly from the context of oppression. Internalized sexism can present as self-objectification, so thinking of oneself only as the object of desire, love, what have you for men. Invalidation of others or oneself, or derogation based on your own sense of self-worth relative to qualities that men are supposed to have. It can lead to competition between women as they're vying for those limited resources and spaces of power. Internalized powerlessness, feeling like you really have no control or agency over your own life, and then loss of self. The ways this manifests, so shame-based beliefs. Women who have experienced sexism tend to show an altered sense of self-worth and negative attitude towards other women. The more experiences of sexism a woman endures, self-blame tends to increase proportionally.
As opposed to seeing it as something that has happened to them, it's happening internally. I mean, obviously that's why we're calling it internalized sexism, that's why it's called that, but that it's, I must have done something to create this. It's my fault somehow. Also, they're popping balloons out there and I'm very distracted. I'm paying attention to my own presentation, I promise.
Another way that internalized sexism can manifest is self-silencing and over-apologizing. There's also interesting linguistic tags that women will use. So they will put I think onto the front of a sentence, or maybe, or perhaps.
Possibly, I don't know, but
yeah, this is just my opinion, etc.
you all are looking around because you're like, oh,
Yeah,
how
I
often
do
do I
that
do
too.
that?
And
Every single day.
we might say, oh, well, but that's because I'm being polite. But it's a particular type of politeness that is associated with female gender behavior.
Let's think about how we write emails in
Yep.
this kind of thing, like
Yes.
exclamation points and
Yes.
like when you get an email from a man, like I always have to check myself and be like, they're not mad. This is just they are socialized the same way as us, and this is how I probably should send an email in all honesty. But I was thinking about that with like the self-silence thing and like the how like exclamation marks like take the bite out of email, things like that.
Yeah, I
Smiley face.
I actually have a client, or it's not client, well, I do have a client who was accused of having her emails sound, quote, manly, but it was because they were short and to the point, and it was in her evaluation as a critique, right? And I do have a friend who she will write emails and then she will put them into ChatGPT and say, please make these sound more direct, because she does not want to overly apologize. She does not want to sound passive. And so she asked ChatGPT to help her make them less female coded, basically, right? So that that she doesn't come across as overly apologetic.
One of the more pernicious elements of internal sexism can come from positive contact with non-allied men. There's research showing a sedative effect that occurs. So sedative effect refers to the ways that interacting with folks who are non-supportive from the dominant group can actually impede collective action between those of the outside group. So in this case, we've got women who might be less inclined to band together if they have male allies or men who are yeah. And I think one example that we might give of this too is so this was a woman on Jimmy Kimmel, you know, one of those like interviewing the woman on the street kind of thing. She was a truck driver. And she obviously is in a profession that is chock full of men. And this was when Hillary Clinton was running for president. And she refused to vote for a woman because women can't be leaders, they can't do a man's job, et cetera, et cetera, et cetera. And I found myself thinking that she sees herself as exceptional because she's been accepted by these men. It's not that all women can do this, right? She's not creating more connection with other women and lifting them up. She is associating herself with men instead. We also find essentialist arguments. This is a belief that gender differences are fixed and inherent. They just are what they are. Women are just naturally nurturing. They're naturally passive. Men are naturally protectors, etc.
And if they're not,
Then
there's something wrong with you.
exactly. Yeah.
If you don't want to have children, then there's something wrong with you.
Yeah.
Right? You're an outlier, and it's a little strange, is the perception.
Mm-hmm. But in fact, research shows that there are more differences between folks of the same gender than there are between the genders. Much more variation in that way. So some of the ways that this continues to manifest, we have body surveillance and objectification. So women paying close attention to not only their bodies, but other women's bodies, and policing those bodies. This is related to women's experience of being sexually objectified, which is correlated with depressive symptoms. Women are flooded throughout our daily lives with messages that indicate our value and worth is in our physical body. And the extent to which we adhere to whatever the feminine ideal happens to be.
And what our body
And
can
our-
provide.
Yeah, that too. And again, this can lead to depression, psychological stress, and disordered eating. And then, of course, there's the policing of other women. This can be related to body policing too, but also the stigma of identifying as a feminist or exhibiting qualities that are associated with masculinity. I have friends from college who 100% were feminists, but could not accept the label of feminist because of what it connoted to them. Feminists are perceived as aggressive, opinionated, forceful. We are nonconformist, anti-male, stubborn, tense, and egotistical. So a lot of these negative connotations.
Which, by the way, if many of those descriptions were put on a man, it would be seen as positive. But,
Right.
Yeah.
We just tease those out so we have assertive instead of aggressive, right? Tough.
Headstrong.
Yes, yeah.
Yep.
Women labeled as feminist can be perceived as complainers, and that they are unlikely to actually be a victim of discrimination. We also find the double-blind dilemma, and I remember this coming up when Clinton was running too. You can be nice but weak, or you can be competent and unlikable. So this is the double bind that women, and particularly women in leadership find
You can do what in a
You can be nice and weak, or you can be competent or
You can't be
unlikable.
both.
Yeah.
You cannot be both.
Yeah.
You were saying something?
I was just saying that this is something we typically find, we often find particularly in women who are in positions of leadership, and there's just no way out of that conundrum. There's a lot of psychological impacts of internalized sexism as well. We've already talked a little bit about kind of general psychological distress and lowered self-esteem. This can take the form of self-blame. So the belief that one has elicited or is responsible for whatever discrimination that they are experiencing, or their sexual objectification, their harassment. Experience of these types of acts of objectification can lead to feelings of depression and hopelessness, regardless of whether the individual is particularly prone to shame. So even if you don't necessarily blame yourself, you still might find yourself depressed and feeling like there's no way out of this. And it can lead to decreased coping skills and resilience over time.
Because you're exhausted.
Yeah.
You're exhausted.
Has a lot of impact on one's professional identity, can lead to self-doubt, burnout, perfectionism, when there is no space for a woman to make a mistake. That puts a tremendous amount of pressure on them. We can find a lot of hesitancy in leadership, which is a quality that does not align with the assumptions of what we think are supposed to be leaders. It's also something we see in women reluctant to take on the role of a leader in the first place. There's research showing that men are much more likely to apply for a job when they don't have all of the qualifications, whereas women, if they don't have all of the qualifications, will not. Even if they might have most of them.
Funny, not so funny saying that a bunch of my friends and I will say is, we just all need to have the confidence of a mediocre
Yes.
cis white man, right? And then we will rule the world.
This can lead to difficulty setting boundaries and saying no if somebody asks you to do a thing. If they're trusting you to do this thing, right, then you've got to do the thing and take it on. And for God's sake, you can't say it's too much, because then you have demonstrated your weakness or demonstrated your incompetence.
Okay. All right. I'm gonna move over here.
Still my water. We'll do a little dancing later.
Let's see. Oh, there's 5 people. Okay, cute. Oh my God, goodness. Okay. Let's just do this. All right. How's everyone feeling, by the way? Yeah? Great? Wonderful? Perfect? Yeah? Ready to take it on? So our women clients commonly present with issues related to a lot of the things we're actually talking about, and we don't realize that this is what we're talking about. So the self-esteem, body image, issues with identity, I want to say especially with young female clients, but it's not necessarily the case, right? It's really across all ages. And issues with, relational boyfriends, partners, mostly male, but not necessarily, right? Of just struggling and not necessarily knowing where their voice is, where they can assert themselves, who they are without in sort of any reference to another person, especially men. So adolescent women specifically present with unique issues regarding peer relationships, body image. I mean, that is true. That is true. But again, I would say really what I have found is that there is less of it, but there's still enough of it for it to be noteworthy across all ages of women. So this internalized sexism, it does impact clinical practice and clients and you, because you, as I'm assuming, all identify as women, though, again, we didn't all go through the room and say, but possibly most of us do. We are dealing with this as well, and not necessarily realizing that internalized sexism is what we're dealing with. And so there may be ways in which we pass it on to our clients, not recognize it in our clients, and then talk about a do-si-do, right? So in terms of counselors, there is the gender bias, maybe a lack of interest or awareness that internalized sexism is what is happening, or a misunderstanding about why a female client did what she did because of the factors that are at play. You're projecting your own internalized beliefs, right? Sort of judgment onto the woman. And then, so to reference the research that I did, a lot of the women who I interviewed said that they act differently with their male clients, that they feel like they have to act more as if they know what they're doing because they are aware that there's probably a judgment that the man is thinking, I don't really listen to women, and you're a woman. And so I have to project more strength, knowledge, and less of an authentic me in order for you to hear me, literally to hear my voice. Not all of them, but many of them did. So missed opportunities of empowerment and connection with other women, because the best way to oppress people is to have the oppressed oppress themselves. Hey, you don't have to do the work anymore. And so the new internalized sexism is the new sexism is my tagline right now, right? If you have yourself oppressing yourself and the other women, then the oppressor is like, hey, I can just sit back, right? And then you might not be comfortable calling these things out. You might not necessarily, again, recognize it, or you have a discomfort in it because it feels too confrontational. And confrontation, as maybe many of you have learned, is not a bad thing. In fact, it's very good for our clients. Conflict is different, confrontation is good. And to confront them and say, I think what's happening is your internalized sexism, right? You are overly apologizing for yourself. You are monitoring yourself in a way that you wouldn't if you were a man. So pointing that out. And just maybe a discomfort in perpetrating oppressive dynamics if you, again, don't feel comfortable. So it places blame on the oppressed, don't feel comfortable. So it places blame on the oppressed rather than the oppressors. So again, the work is already being done if you oppress yourself. So the paradox of awareness is that you have this awareness and you think, oh, okay, so then if I have the awareness, it's done. That's not usually how awareness works. Awareness is the first half step, I say, right? It's not even necessarily a full step, but to have it is important. And that's why we're having this conversation right now. So gender traditionalism is linked to greater depression and anxiety, invisible expectations and pressure on men and women that resemble traditional behavioral norms are associated with one's gender. All of these things are good to know. This awareness. Increased amounts of higher education does not necessarily protect you from this. In fact, it might in some ways perpetuate it because, again, you're like, I'm educated, I got that degree, I'm an independent woman, I love Taylor Swift, and I love Chapel Roan. What's the problem? Like, I'm doing great. And so you tell yourself a story about how you are equal, that you are just as empowered, that you aren't being discriminated against. But are we still dealing with this? Yes, yes. So sexist behaviors can go unnoticed or unchecked because of these assumptions that we make about, okay, it's 2025, we have the same access. Look at Hillary Clinton, she ran. Kamala Harris, she ran. I mean, they lost because they're women. But anyway, I mean, we can say there are a lot of reasons. But so progress can actually be confusing in a lot of ways, and progress can be confused. So the counseling profession, let's talk about it. We are disproportionately women dominated. Over 70%, yeah, go ahead.
This room.
But also, I do want to point out, there are 14 of you in a pretty small space, which is awesome, and yet we have no people that I think identify as men. I'm actually going to ask, why do you think not? Yeah.
I think a lot of men would think it applies to them, even though they have counselors and colleagues who this applies greatly to them. I also think there's a lack of, the oppressors don't want to take responsibility.
Like, that's not my job?
Yeah, no, with it being internalized in the title, they're like, well, I don't have it internalized, but they clearly do.
Right.
Yeah.
Well, they just have sexism. They don't have internalized sexism.
Sure, yeah.
Yeah. What's that?
I said, but it's in there.
Oh, it's in there. Yeah.
I was just gonna say, like, makes them uncomfortable because if they were to hear something, and they're like, oh, that kind of is at home, then it's like, well, what are you gonna do about it now? And so if you just avoid it, and don't, like, in their mind, it's like, you just push over here, you don't have to do anything about it.
Right. Like, yeah.
Not all men.
Not all men. Not all men what?
Anything.
So we are heavily dominated with women, and yet this is still something that maybe many of you are like, whoa, I didn't really know, right? It's not your fault, okay? It's not your fault, but it is still shocking that over 70%, and we are definitely having to have this conversation. So this is seen as women's work because it's caring, it's empathetic, it involves feelings, right? And so what comes with that? It requires emotional intelligence, provides some level of caretaking. Maybe more women or more people will do that than others. I've definitely met some women counselors that are like, I'm not your caretaker, right? I'm not gonna be your mom. And then other traits associated with women and more feminine qualities. So because of this, our profession often, and I would say other women-dominated professions, nursing and teaching, you are expected to get paid lower and to not ask for more. And if you do, what are you trying to do? Make money from your job? You should feel lucky you get paid, right? There isn't the same prestige, right? You got a nurse and then you got the doctor. And then limited upward mobility, or the upward mobility, you take longer to pursue it. I was a teacher before I was a counselor, and definitely the men who became principals, they had much shorter amounts of experience teaching, but they're like, I got it. And the amount of men principals was noteworthy, right? And they were overseeing mostly women teachers. Yeah.
Yeah, I was just gonna say, one of the things that I've done as department chair was try and make sure that I can get the women who have been stalled out at associate promoted to full. Because after female professors get tenure, and promoted to associate, then they also get landed with a lot more of the service expectations as well that prevent them from doing research, and only intellectual work gets you the profession.
Yeah. And I do think also what I've seen and what I've heard from the research that I did is that there's this false sense of autonomy in professions dominated by women. Well, we're women. We look out for each other. Well, we should, but do we always? Again, it's this idea of if you have the awareness, if you have the education, you're protected. Not necessarily. And also, just side note, women are more likely to be seeking mental health services in general, so the majority of your clients are going to be women. Less so if you work in the schools, right, because you have those referrals coming in. But definitely people who are choosing to seek services are mostly women, I would say. Okay, so the current research study that I'm working on, like as I stand here, is that I was able to, so it's a qualitative research study, and it's examining the effects of internalized sexism. And I interviewed 16 women-identified counselor and counselor educators. I did this just this month in October. And they were across the country, various points of their career, I would say from 1 year of clinical experience to 30 years of clinical experience. The findings were insane in the sense of I didn't realize what I was going to find was what I found. So we found, so me and my research team, my incredible GAs and my sister, adorable, found 68 themes.
In 16 people.
In 16 people. We had to stop because it was just, the data was wild. And these are some of the things, but again, we're looking at 68 that we've had to pare down to 10 because no one's going to publish 68 themes of internalized sexism. Exhaustion was one of the main ones. I'm tired of doing it all. I do all the work. I do all the mental labor. I even do some of my husband's chores or tasks or duties because I want to show him that I can do it too. And he goes, okay, that's fine. Right. Shame, a lot of shame, a lot of uncertainty and confusion about the difference between sexism and internalized sexism. Lots of confusion. They would say, the participants would say, well, I have these male students who talk too much. That's not internalized sexism. Now, I'm not criticizing, but they would say, okay, well, I have one male student and he talks a lot and he says offensive things. Well, that's sexism. But then when I would point that out, they would struggle to identify. Well, I don't know, it's there, but I don't really know what it is. I don't know what it is. And I don't really know how to find it. And really, it was this idea that it's all around us and it's everywhere. It's the water, we're fish, we're swimming. It's the water and we can't see it. And so another quote, I love that I'm quoting myself. This is really weird, is that women can't identify internalized sexism because it's who we are. It is actually how we engage in the world. So how do we break this cycle? So knowing what it is and knowing what sexism is, what it isn't, what internalized sexism is and what it isn't is a really good starting point. I talked about this in Allison's class the other day, and I had a student who was like, I have an example and I would really like you to tell me if this is internalized sexism or not. And it was really sweet because she just was like, I just want to check. And she was wrong. I mean, in the sense of it was not internalized sexism. It was the example. Do you remember? Okay. She said, I'm afraid to walk to my car at night. And I want to reach out to a male colleague to help me walk to my car instead of a female. And I said, that's not internalized sexism, that's just you being smart. Yeah. Because it's your safety, because of sexism, and because the greatest risk to women is men, and the greatest risk to men is heart disease. Yeah. Right? You had a question. Oh, okay, great. You're just like, yeah, yeah.
I'm
so
wondering what the two counselors are, like, I'm still stuck on that.
Well, yeah.
This is the last session.
Oh, they're like, I gotta go. I love my male counselor voice. Okay, so let's talk about what it is. We've sort of talked about it, right? But it's overly apologizing. Sorry, I just have a quick question. Sorry, why are you apologizing? If you're in class and you're asking a question, you have paid to ask that question. That question probably costs you $20. It maybe costs you $200, right? I just have a quick question. I won't take up that much space. I won't take up that much of your time. Take up as much time as you need to, right? You're allowed. Sexist language towards self and other women. I would actually love to ask you all for examples. What do you think are some not so kind words that we use towards ourselves and women that are about our gender? Yeah. Lazy. Lazy, okay.
My friends and I will jokingly call each other a bitch.
Bitch.
I know it's bad and
Yep.
frustrates it, but it also makes us laugh. We know it. I think if I didn't know that, it would be very different. But still, that's internal.
Yeah. Yeah. Yeah.
Same with like slut or whore.
Mm-hmm. Mm-hmm. I mean, all of us could do this. Like, did you have your hand up?
Yeah, I was gonna say feeling like, or talking to myself like feeling entitled instead of just being like, oh, I'm just asking for what I would ask for, right? And feeling like that's
You mean asking for what you need and want?
yeah.
Yep.
Dramatic.
Dramatic. Emotional. Just being hysterical. Yeah. So reducing or diminishing your role. Oh, it's not that big of a deal. I did it maybe I did it in class, but I definitely did it in a faculty meeting. I won an award and.
You totally did it in class.
Damn it. Okay. I won an award this year, and well, I guess I did it in both. And instead of,
It was the Kentucky Counselor of the Year award, right?
gosh, how cool. And I'm like, my instant reaction is, it's fine, right?
Why are you doing this? Why are you making it so small?
Yeah, exactly, yeah, exactly.
She wouldn't even
So-
say what the award was, anyway.
Right. But in our faculty meeting, our dean, or I'm sorry, our department head said, just want to make this announcement, this is really great. And I said, well, they had to give it to somebody. And everyone and this is where I love my faculty, I love my coworkers, they were like, oh, like that is, they like kind of grunted like, that's horrible that you would say that. So that sort of thing, making yourself small, literally and figuratively. Our bodies are often very scrutinized, right? Don't be too loud, don't be too big. Your size, don't be too big, don't have your voice be too loud, don't be too colorful, don't be too, all of that. So invalidating the work that you do, deferring to other people's opinion. I don't know, Todd, what do you think? I don't know, maybe you have a better suggestion? No, you know what you're talking about. You know what you're talking about. So naming it when it happens, language is definitely the first intervention, and language is very, very important. Like Allison pointed out, I didn't even name the award. I was like, there's this award that I won, what is that? So breaking the cycle is having counselors and supervisors definitely using the feminist multicultural orientation model and not being ashamed of that, not being embarrassed, and not being apologetic about being a feminist. Right? Like it is by design that we no longer feel like we can be a feminist because it is embarrassing, it is shameful, and it is wrong. Yes? Oh, I like y'all are like just doing this, I like this. It's like the Berkeley snap. And then the social justice competencies. So modeling and engaging in professional peer support groups, definitely being like, we're calling you all out. Like you did a good thing, you did an amazing thing. I mean, Allison just did that right now. Like you named the award. You talked, you made yourself small as the professor in the class about awards you won. Just brag, right? And so allowing other women to brag about themselves. I do this all the time in my class with students. I'm like, stop apologizing. Stop. Like, I will fail you if you apologize one more time. And I mean, I can do it. Yeah. They might sue me, but and challenging these things, the language, and then the mental health community can be a protective factor. We can be this phrase is kind of silly because it's overused, but we can be the change that we want to see in the world as far as this issue, right? You are working one-on-one with other women who have mental health issues, many of which the mental health issues are perpetuated and created because of their gender. So you can be the ones to be like, let's figure this out. Let's find some solutions. How can you talk to yourself differently? How can your internal dialogue sound different? So creating a workspace that is encouraging, educate and promote boundary setting. I'm looking at time. Okay, we're good. So boundary setting, no is a full sentence, and no doesn't make you mean. It's just, I'm amazed that people are like, I'm not trying to be mean, but I just can't. Great. Wonderful. I'm so glad you can't. I'm so glad that you have said to me, you know what, I just want to go home and watch true crime. Yeah, I've been watching a lot of true crime. I think I need to stop. It's too much. It's too much. So, maintaining the same expectations for all counselors, which means what? What does that mean? You have an idea, friend?
I kind of do, but I can't form it yet, like, something, I mean, obviously, like, maternity leave and like that kind of stuff.
Sure,
right?
yeah.
Your practice, but something about there, but it's not there yet.
It's okay. Yeah, we got it. Yeah. No, see, this is it. This is it right here. Just speak, and then you'll speak.
I think like the same emotional way, like having the same boundaries. Like I know some of like I work in practice and we're all women, but there's one guy, and he like is better about not checking his email or
Yep.
text after work, and like oh my gosh, I'm having such a hard night, and I stopped it and I don't answer them anymore. I don't even read them. My phone automatically turns them off for me. But I think like, and also like when we're doing peer consultation and things like that, like it's not so much that we listen to him, I don't think we listen to him more, it's just
But
that,
his voice is more valid.
yeah.
Yep.
Who cleans the communal kitchen?
Ooh.
Oh, our
Who takes the
receptionist
notes?
does. Yeah, yeah, our receptionist does, who's also.
Yep, yeah.
I was thinking of just like having boundaries in general, because I think that it's probably likely that women will do more work just naturally, not naturally, but because we've been
Naturally.
supposed to do so.
Yeah, right,
And
yes.
men will do less work because women will probably pick up the slack,
Right.
right? And so like having boundaries saying like you can only see so many clients a day, like everyone needs to average this many clients and having parameters around workloads in general and like leaders, supervisors being able to follow up on those and like check in on them and make sure that people aren't overexerting to try for.
I also think it's seen as male counselors doing more serious work, or they're more, they kind of blasted, like shoot to the top for their work because they are outliers. They get their licensure, they get when they are getting paneled with insurances, they get bumped to the top because there are so few male counselors and insurances would rather panel them.
Yeah.
Sorry.
No, I mean, these are all really important things that, again, they happen and we see it, we just kind of accept it and we see it as normal, but it's only normal because it's been normalized. It's not actually normal. So I think that this is a huge one that you were touching on, is like overworking and burnout is just an expected thing that women in particular are just going to experience. It doesn't have to happen in this job. Definitely our job is hard, but it doesn't have to be impossible. It doesn't have to be wildly unattainably, let me try and say this again. We can be happy and do this work and not be overwhelmed by it. So self-awareness and having these issues be invisible is very corrosive, and it can be corrosive in a very subtle way or an overt way. Decade after decade of feeling like you are taking more of the weight and the burden of something, at a certain point, you are absolutely exhausted. So think of that with this job, with then being in a heterosexual relationship. I mean, also queer relationships, but more heterosexual, where you're expected to be kind of like household manager and then insert children. There's that too. Let's see. Move on. All right, so we have 9 minutes. Great. So I would like to actually skip to this. So where have you noticed it, and are there spaces where it's more obvious? And we're talking about obviously internalized sexism. Where have you noticed it in we'll say in the space of this profession because of where we are? Yeah.
When you're talking about your award, I didn't realize that was why I won an award yesterday. I won the Excellence in Communication Award.
Nice.
Thank you. And I was so bashful about it, and like I felt like so shy, and I couldn't figure out like why. And then I also realized I was downplaying the award I won because it's a communication award, and I was like, well, it's just for like writing. And I host and produce and write the Conference Association's podcast, and we developed 2 new shows this year. One of them is like legislative updates and informing councils about legislation in the state and on the national level and things. And I was like, well, it's just, I don't know, I just maybe it's like a podcast or whatever. And I was like, oh, damn. Whoops. So yeah, that was just a big light bulb moment because I do so much feminist therapy and I think about this so much. I talk about it so much with my clients, especially my kids. And I was like, oh, it got me. So,
Yeah, it's got all of us, and that's okay. So we go boop, boop, boop. Yeah.
I noticed with the couple I'm working with, they have experienced infidelity, and the wife feels guilty for not being able to reach forgiveness quickly in like 3 or 4 instances of infidelity, and I have to keep normalizing like your emotional state is like congruent with what you've experienced. Like forgiveness is not something you can will upon yourself, and it's not even where you need to be right now in this situation.
Yeah, one of my participants in the study does a lot of grief work around relational disruptions and ruptures, especially with infidelity. And she was saying that a lot of the women internalize it and think this wouldn't have happened. He wouldn't have, done the things that he did if I had done more. If I had just been sexier. If I had been more of the wife that he needed, it's my fault. So if I can make myself, and she said that she will find that a lot of the women will go through transformations to be like, this is how I save my marriage, meaning like surgeries, and other things to make themselves more desirable to the husbands. Okay, do you have a? Yeah.
I'm a grad student, and so
Yeah.
I noticed a lot, and even with my boss who works in a health and wellness space at our university, is that taking on so much to prove yourself, that not like maybe to prove to yourself and also to prove to others around you that you
Yes.
can do it.
Yes.
I that really it was like one blip of what you said, and I was like, wow, that really hit home, and I see that with the women around me as well.
Like taking on a tremendous amount, like
Yes.
too much is what you're
Mhm.
saying. Yep. Yeah. And then yeah.
So I'm a person who loves to do research, so I noticed this extremely in the research field of counseling. And it's interesting you brought up true crime, because that's part of my research is women in true crime and why women are the majority of true crime consumers, but I'll talk to you about that.
Yeah.
But like, I think even though we are the dominant group in the profession, I guess, it's still the majority male, created theories and male created, research.
Oh yeah. You mean in counseling?
Yes.
Oh yeah.
And everywhere, but.
Well, yeah. Yes. Yeah.
I was going to go off what Kate said a little bit. I had this experience where I work out at an inpatient, or it's not a report order, but an inpatient at a children's mental health facility. And like as a worker, I've been like prioritizing, like, I don't know, dumb stuff like going to the bathroom, like I'm gonna go to the bathroom, I need to go to the bathroom. Or like if I have stuff I need to get done, I'm gonna be like, hey, I'm gonna sit down and do this. Whereas I have like a coworker who's not good at that, and then I was like, well, you're like leaving when they don't have their stuff done, and like helping them out, and I'm like, okay, but just because I'm good at prioritizing like my stuff and I prioritize that, it was like looked down upon that I'm not like helping out them on their tasks, and like looked down that like I'm taking care of my needs of like going to the bathroom and eating.
Right. Seen as selfish.
Yeah, I just like can stand up for myself. Like I'm not gonna.
You're existing as a human. It's not even standing up for yourself.
And it was kind of like looked down upon. I was like, what do you mean I leave when my shift is over? Like, yes, I do, because all my stuff.
And it's not my job to stay here and
Right.
do more work and not get paid. Yeah. Anyone else? Yeah.
Another one, when someone comes in with a diagnosis already,
Oh yeah.
how confident are we in challenging that diagnosis? How confident are we in saying that we agree with that diagnosis or not? I don't have a lot of experience in that, other than my experience as a client.
All right, so then the last thing is just, this is a call to attention and action. Genuinely, it is something that I feel like should and can be changed, should be changed. It starts in the classroom, it starts everywhere, so that's not helpful. But it's up to us to recognize it and sort of disseminate this information. I am, again, really excited about the research I did, because I feel like it's slowly getting the conversation going around what this is and how to change it. Because what I found in the interviews was a lot of them could say, well, I know what internalized homophobia is. I know what internalized racism is. I can recognize when that happens, but I don't know what internalized sexism is. And we had some really deep conversations about why. Like, why those two other things, but not this. And so coming here, first step, great. So knowing that this goes unnoticed and excused a lot by men and women and other folks. So just being committed to being self-aware, and the importance of re-examining. So like you did, myself, okay, fine, I'll take it. Re-examining the stuff that you do that perpetuates it, and how much that is detrimental to yourself, your community, your clients. And again, I'm not saying like shame on you, right? But just, it doesn't have to be this way. And yeah, Allison, do you have any other thoughts?
So one of the things that has been really interesting to me in considering all of this in the first place is that I am the type of person who has a lot of qualities that are considered less stereotypically feminine. I have a lower voice. I have broad shoulders. I have grown up in a context where I happen to be around women who have positions of power who were in less traditional fields. My dad is a physicist, his best friend was a female physicist. I've never been shy about speaking out, and yet I can, so it's like thinking about how do we even identify it ourselves, like where do I even see it, right? So because my default is, well, but look at everything I've done, right? You know, I'm department chair, and I'm doing these things, and people are respecting me, et cetera, et cetera. And then just taking the opportunity to think about it, well, what are the ways that I've absorbed some of these things, right? I do have anxiety about the fact that I'm not feminine enough at times, right? Even though intellectually I reject it, internally it's absolutely there. I want to be Vivian Lee, Scarlett O'Hara. I don't want to be Belle Waddling, right? The blousy, redheaded thing.
Yeah, I think, and that's a great thing to end on. Does anyone have any questions or comments? Yeah, oh, yeah.
Oh, sorry, just like something that really clicked as a lesbian thinking about this within queer, specifically sapphic communities. I think this makes sense. Hold on. The way that more femme lesbians or queer women are looked at versus more like butch androgynous.
Right.
And that as like not queer enough, like that's like a weird, interesting intersection of queer and internal sexism, and it just like, yeah, that just.
I mean, intersectionality when this issue is such a monster part of it, like the women of color that we interviewed had very different things to say than the white women. Not very, but there were specific things said that were not said by the white women. And unfortunately, I won't be able to touch on that not really be able to touch on it with the study, but it is definitely a part of it. Like if you are a white woman, if you are a masculine presenting woman, if you're a straight woman, you know, all of these things, that's playing into it as well. There was one more comment?
Oh, I think the hardest part for me is kind of what you touched on. Almost this like self-loathing where I have a very supportive community,
Right.
a very supportive spouse that I wouldn't say perpetuate these beliefs I hold about myself, but I carry so much guilt that I know is not rational, but like it is crazy, especially like body image, my own like reproductive health, like I feel so much shame. And I'm like, where are these, like no one outside, and I'm like, where are these, like no one outside of me and people I trust is telling me this, but my soul, there's a part of my soul that is like just deeply convicted that this is true, and it's like soul crushing. It's very hard to navigate.
But watch the media that we feed to our children.
Yeah.
Watch what we put into our kids as children. On the expectation is you will find your prints and everything's fine.
I mean, just go to the toy aisle at Target and everything will make sense. Yes.
I was thinking that same thing when you were talking, when you guys were talking, I was thinking, and there's a whole nother layer.
Oh, yeah.
Of African American.
Absolutely. Yes.
Just the male, female, everything, so it's a whole nother can of worms.
Well, I had one participant who identified as an older Black woman, and she said, "Oh, I don't know if the expectations are because I'm a woman or because I'm a Black woman or because I'm Black, and I don't know, and this is hard, and it's hard to figure out what is what is what is what." And that was part of the frustration, which makes sense, of like, I don't know where this comes from. And so I got to kind of figure that out as I move forward with this. If like, there's so many different factors that can be playing into why we feel the way we feel.
What's rolling around in my brain right now is that for those of us that are in the queer community, how much of this is internalized when I have a person, a trans person in front of me. My partner has a trans child, and I think I was struggling with some of this luckily we can talk it out, but like,
Mhm.
and I think there's applications to it based on the intersectionality to it, teasing out, like you said, what comes from what.
Yeah.
But this is the one of lots.
It
that
is,
we do.
it is, yeah. This is definitely the launch pad, not the landing strip. Yep, so, all right. Thank you very much. You're all done, right?
Yeah.
Yeah, eat some more candy. Don't worry about body image. I'm curious, have you ever